Wanda, it has been 10 years since we get married, but yet we still don't have children.
I'm sorry, Abba, for not being able to give you any children. Just let me go, Abba.
Wanda, please, don't say like that. I don't want to let it go, no? I still love you since day one. Wanda! Wanda, please don't cry, Wanda. I'm sorry. I'm sorry for being emotional just now, Wanda. I have a way. Let's go. Just follow me.
Follow you?
So, Doc, we have tried everything to get children. What's wrong with us?
Encik Zakwan, Wan Wardah, maybe one of you guys is infertile. And based on the data, maybe one of you guys also have some health issues that stops Wan Wardah from getting pregnant. If you guys still want children, you guys can try assisted fertilization.
What?
Okay, but the first question is, what are assisted fertilization treatments? Or what are assisted conception treatments? So, assisted conception treatments is a treatment using a medical intervention to help you conceive or getting pregnant. So, the treatment continue to improve as the years go on, which means that the younger you are, the greater your chances of conceiving or in other words, getting pregnant. Okay, so we move to the next question, which is, what assisted conception treatments options are there? So basically, there's a lot of options and methods for those who want to undergo these treatments. So for the first one is IUI, or we call it as intrauterine insemination. So the sperm cells are inserted directly into your womb or uterus at the time of ovulation. So for the next one is IVF, or in vitro fertilization. So the eggs are gathered from your ovaries and combined with your partner's sperm in a laboratory dish. So the resulting embryos are transplanted into your womb. And other than those two methods, donated sperm, donated eggs on embryos, and lastly is surrogacy. But surrogacy is forbidden in Islam.
So now I will answer some questions regarding IVF. The first one is, what will happen to unused embryos? The answer would be, unused frozen embryos either kept for further research or be destroyed. The next question is, what kind of tests we need to take in order to conduct IVF? The first test is hormone profile for women to check whether they have normal ovulatory function. The next test is high stereocell thermogram, which is a type of X-ray with contrast to look for tubal patency. And the last test is seminal fluid analysis to look for male cause of infertility. So the next question is, in what condition or situation one is suggested to undergo IVF? The first one is fallopian tube damage or blockage. Fallopian tube damage or blockage makes it difficult for an egg to be fertilized or an embryo to travel to the uterus. Next is ovulation disorder. When ovulation stops or absent or infrequent, there would be less egg to be released for fertilization. And the next cause is premature ovarian failure. Premature ovarian failure is the loss of normal ovarian function of a woman before the age of 40. If your ovaries fail, they don't produce normal amounts of hormone estrogen or have eggs to be released regularly.
Okay, so there's a lot of risks or disadvantages for those who undergo the assisted fertilization treatments or the assisted conception treatments. So for the first one is miscarriage. Okay, miscarriage. So the rate of miscarriage for women who conceive using the IVF or the in vitro fertilization with fresh embryo is similar to the woman who conceive naturally. So next is stress. So for those who undergo this treatment or the IVF can be financially, physically or emotionally draining. So support from counselors, family and friends can help you and your partner through the ups and downs during the infertility treatment. Okay, so for the next one is multiple birth. So during the IVF or the in vitro fertilization, it will increase the risk of multiple birth if more than one embryo implanted in your uterus. So a pregnancy with multiple fetus carries a higher risk of early labor and low birth weight compared to the pregnancy with single fetus. And for the next one is premature delivery and low birth weight. So research suggests that use of IVF or in vitro fertilization slightly increase the risk that a baby will be born early or with a low birth weight. And for the last one is it is expensive treatments. For those who want to undergo these treatments, it is expensive. Okay, the next question will be what is involved in IVF. There's basically 5 steps. So the first step will be a fertility medication will be prescribed to produce more eggs, and more eggs is needed because not all eggs will be fertilized. And then an intervaginal ultrasound will be conducted towards the vagina, and a blood test will be conducted to check on the hormone level. Okay, the second step will be eggs are retrieved through a minor surgical procedure that uses ultrasound to conduct the hollow needle through the cavity to take out the egg from the ovary through a minor surgical. And so medication will be provided to reduce or remove the potential discomfort. Okay, the third step will be that the male is asked to produce a sample of sperm which is prepared for combining with the eggs. The fourth step will be there will be a process called insemination, whereby the sperm and the eggs are going to mix together and stored in a laboratory to encourage the fertilization. In some cases where there is a lower probability of fertilization, an intracytoplasmic sperm injection or ICSI may be used through this procedure. And in that procedure, a single sperm is injected directly into the egg in order to achieve fertilization, and then the eggs are monitored to confirm that fertilization and and the cell division occurred to get an embryo. And the last step, which is the fifth step, will be the embryo are usually transferred into the woman's uterus. Eggs, woman uterus 3 to 5 days following egg retrieval and fertilization. A catheter or a small tube is inserted into a uterus to transfer the embryos. This procedure is painless for most women, although some may experience mild cramping. If the procedure is successfully, implantation typically occurs around 6 to 10 days following egg retrieval.
Okay, the question is about the fertilization treatment in the Islamic perspective. Okay, for the answer is, the Muslim scholars have agreed that husband and wife, that having a child through this process, the IVF, in vitro fertilization, is allowed in Islam, as long as the husband's sperms and the wife ovum are used in this process. But it becomes haram when we go to the sperm bank and like egg donors, so it takes from somebody else's eggs. So this is haram in Islam because this is the type of zina. And another one is when the sperms and ovum from the couple, the marriage couple, for example, the form become into the zygote form and it is put into another woman uterus. So this is also haram in Islam. So the only thing that is allowed in Islam is when the use of sperms and ovum only for the marriage couple, and after the fertilization have formed into the zygote form, and the zygote will be put it back into the mother uterus, the wife uterus. So that's the only things that are allowed in Islam. Okay, the next question is regarding the masturbation for the sampling of the husband's sperms. Okay, for this question I have two perspectives. Okay, the first one is masturbation is, we all know masturbation is not allowed in Islam. So it is recommended that the collection of the husband's semen can be done by the context of intimacy with his wife, but without the penetration. Okay, the second perspective is, okay, what is the purpose of the masturbation? Is it for fulfilling your nafs or for the medical treatment? So in this case, it is for the sampling, to check the sperm's health. So it is for a good thing, for having a baby, you know? So it is most likely, it is according to our niat, our intention. So that's the answer. From this ayah, it shows that Allah, our Creator, is the most powerful. He can give life, a child, to anyone He wants. If a marriage couple get a child, it is a gift from Allah. And if not, there must be some particular reason behind it. Because Allah, our Creator, He knows everything about it since we were born until we die. So don't lose faith in Him. Don't lose faith in Allah. Thank you, doctor, for your advice. Come on, brother, like this. Dr. Dini,
Yeah, Dr. Wan.
you know what? They are so sweet together.
Oh, yeah, I know, right?
Zoom out.